Hi there. Ever wondered how antihistamine drugs work in your respiratory system? Well, today we will explore their journey from intake to action. We have nursing students from University of Visayas here to help us understand more about this topic. Let us not waste any time and dive right in. First, how are antihistamine absorbed?
Let us dive how antihistamine drugs are absorbed through the respiratory system when administered. Let us break it down step by step. First comes inhalation. When using devices like metered dose or dry powder inhalers, the antihistamine enters the respiratory system through the mouth or nose. From there, we move to deposition. The drug particles travel through the airways and settle in the lungs, specifically in the bronchi and bronchioles. Next is absorption, where the process begins with dissolution. The drug particles dissolve in the lung surfactant and mucus, releasing the active ingredient. Once dissolved, the drug undergoes diffusion, crossing the epithelial cells lining the airways to reach the bloodstream. This allows the medication to act quickly.
The other form of antihistamine is the oral antihistamine. Once swallowed, the drug dissolves in the stomach and is absorbed through the small intestine into the bloodstream. From there, it travels to the respiratory tissues to block histamine receptors. This process can take 30 minutes to an hour for full effect. Next is the factors influencing absorption. One is the particle size. Smaller particles increase absorption. So number 2 is lung surfactant, enhances drug dissolution and absorption. Number 3 is airway acidity, affects drug ionization and absorption. Lastly is the respiratory rate, influences drug deposition and absorption.
I see, thanks for that information. Now, how does the drug spread through the body to get to where it needs to work?
First-generation antihistamines like diphenhydramine are lipophilic, meaning they can easily dissolve in fats and can pass through cell membranes, including those in the respiratory system. This allows them to effectively reach areas like the nasal mucosa and bronchial tissues, where they help reduce symptoms like congestion, runny nose, and sneezing. However, because they can also cross the blood-brain barrier and affect the brain, these antihistamines can cause drowsiness or sedation, even though their primary action is in the respiratory system. This sedative effect is a common side effect of the first-generation antihistamines.
Second-generation antihistamines, like cetirizine and loratadine, are effective in treating respiratory allergy symptoms such as sneezing, runny nose, and nasal congestion. Their low fat solubility prevents them from crossing the blood-brain barrier, so they specifically target histamine H1 receptors in the respiratory tract without significantly affecting the brain. This makes them ideal for relieving respiratory symptoms caused by allergies without causing drowsiness or sedation.
Oh, interesting. Thanks for that. Well, where in the body does the drug get broken down?
When we take antihistamines like for allergies, the medicine doesn't just stay in our system forever. Our body works to process and get rid of it. This happens mostly in the liver. The liver has special enzymes like CYP450 enzymes, which help break down the antihistamine into smaller parts. These parts are called metabolites. Once the antihistamine is broken down, the body sends these metabolites to the kidneys.
Metabolism occurs primarily in the liver rather than the respiratory system. However, the effects of metabolism can influence the drug's action in the respiratory tissues. So the enzymes involved are antihistamines metabolized by cytochrome, particularly by CYP450. First-generation antihistamine undergo extensive metabolism, leading to both active and inactive metabolites. The second-generation antihistamines like loratadine are metabolized into active forms. So the metabolic pathways. So the phase 1 reaction, oxidation, hydrolyzation, and phase 2 is reaction, conjugation, and via glucuronidation. Make the drug more water-soluble for excretion.
Excellent. All right, thanks for that information. Now, how does the body get rid of the drug?
Here's a step-by-step explanation of how the body eliminates antihistamine drugs administered through the respiratory system. Renal excretion process. First, glomerular filtration. Antihistamine metabolites and unchanged drug are filtered from blood into renal tubules. Second, tubular secretion. Metabolites are actively secreted into renal tubules. Third, tubular reabsorption. Some metabolites are reabsorbed into bloodstream. Fourth, urinary excretion. Metabolites and unchanged drug are eliminated in urine. Hepatic excretion process. First, biliary excretion. Antihistamine metabolites are excreted into bile. Second, intestinal elimination. Metabolites are eliminated through feces. Other elimination pathways. First, salivary excretion. Minimal amounts in saliva. Second, sweat. Minimal amounts eliminated through sweat. Third, breast milk. Antihistamine can be excreted into breast milk.
Most common side effects of antihistamines are generally mild and tend to subside as the body adjusts to the medication. These include drowsiness, dry mouth, headache, blurred vision, and constipation. And there are less common but more serious side effects, and these include cardiotoxicity, anticholinergic effects, liver damage, and allergic reactions.
Awesome. Perfect. Well, thank you guys for sharing this information with the viewers. I really do appreciate your time and the knowledge you shared. It was a fruitful and meaningful discussion with you all. Now to recap, antihistamines are absorbed differently depending on the delivery method. Targeting histamine receptors in the respiratory system to relieve symptoms are metabolized and excreted safely when used correctly. Whether you're using a tablet or a nasal spray, antihistamines help you breathe easier. Thank you for watching, and remember, you need to consult a healthcare professional before using any medication.